There, and we're on.
Good afternoon, everyone. My name is Carlos Semedo. I'm a psychotherapist. Today, I have a big pleasure to have like these three major uh, Canadian Americans who has been doing like a great job to our community in Canadian abroad. So today I'm going to introduce you first Dr. Selena Dipina, who is a psychologist has expertise in trauma. Especially talking about, she's going to be talking about today about vicarious trauma. And then we have a Dr. Rosilde Alves. She's going to talk about burnout. It also is connected to trauma, the cause, effect, and of it. And then we have a Jennifer who's with us today also to share her experience in the work she's been doing with our community across board, Kevin, in the diaspora. So I would like to start with Dr. Rosilda. Dr. Rosilda, how you doing today?
I'm doing well, thank you. It's good to see your smiley face.
It's my pleasure to have you guys around. It's definitely an honor to have you guys today. So, with no more delay, definitely I would like you to share with us a little bit about you. Who is Dr. Rosilda?
All right. So I am a Cape Verdean, Cabo Verdeana, born in Fogo. Moved to Boston when I was 10, and then moved to California in my 20s for grad school. So I've been doing working as a psychologist in California for 30 years now. Specialize in trauma, acculturation issues, relationships. And so mostly I've been working with doing couples therapy, individual therapy, and family work. And I also work at Kaiser doing psych emergency room evaluations. So I'm really honored to be here and give back to our community.
Thank you so much for your service. Thank you so much for your help to the community who need it the most. Uh, it's amazing to know like someone with so much knowledge and expertise in the area, the service you provide. I would like for you to kind of share with us like on the your topic your knowledge. For example, we as a professional, sometimes we find ourselves like with like burn out, right? No energy. We need help too, right? So we need someone to talk to. Talking to you in this case, I would like you to kind of helping us how we gonna protect ourselves, how we gonna save some energy for ourselves, for our family, because most of the time when you go to the work, we do 100%. Come home with no energy, just be like done, all right? So how can we still like provide service to others, but keep ourselves or our mental health intact?
That's a very challenging to do. As we all know, as providers, that we're caregivers. We give and give and give until there's nothing left to give. So, burnout is something that has always existed, but I think with the pandemic, our work really skyrised, and the whole time during pandemic, we were providing care, but we were not. There was no break to self care. It was more worry about the world. How do we keep going? And worried about our patients. And that's what I've observed from my colleagues, is that it was just exhausting to go from going to the office to being locked in house for a few years and then provided service in that way, and everybody feeling overwhelmed. So, you know, burnout, the definition is emotional, psychological, and mental exhaustion caused by prolonged stress. So if that's the
Good.
definition, all caregivers are constant in that state of chronic stress from providing care. Um, and we do have to, how do we deal with that? We do have to take time for self care. And I know Jennifer is going to cover that at the end. How do we self care in a way that's healthier. But it could be something as simple as when you're in the office, lunchtime, instead of eating in your desk, go outside to get some sunshine, take 5 minutes walk around the block. When we go to bathroom, we have to go to bathroom, that could be a time of meditation, centering, giving
Mhm.
yourself some good feelings that way. um, and there's so many things we can do, but the idea is to be mindful that we
Mindful.
also need care.
Yeah. So in
There
that
was
in that way, can how one knows that we are like at the point like we're about to burn it out, like we done, like what's the sign we have want people to find out like I'm exhausted, I need a break.
I think it depends on the person, but I think if
Hmm.
you're finding that you're getting tired easier, you're not sleeping well, you're not eating well, you're agitated, you're not as present with your clients. They're talking and you're sitting thinking, what did they just said 2 minutes ago? I have no idea. These are signs that we need to refocus in self-care and take a break, because if we're not 100% present, that those are signs that we're fatigued in some way.
Okay. Definitely good. Because we all go sometimes like just keep going, provide to needs the most, and if we forgot ourselves. This why most of us we in this feel like we wanted to give, but we're not receiving much. The paycheck doesn't cover that, right?
Not at all. There was a video on YouTube. I wish I had saved it. It was a woman. She had a cup and a saucer.
Hmm.
And she filled the cup with water, and then there was more on the saucer. And then she said was what we give is what's on the saucer, not what's on the cup. The cup being full belongs to us, so we can actually be able to provide care for others. But
Yeah.
in reality, what actually we do is we give out of the cup. When there's nothing on the cup, we're still giving, and that's
See.
when burnout happens. Is when we're running on empty.
Yeah, definitely, agreed. Definitely, this is a topic we actually we discussed in KV the last time, like the burnout, the training we provide to the professionals over there, right? Because they just keep it going, give, and then end of the day you're done. So you talk about earlier about intervention, like break for lunch. What else do you think, like in on field, like as a psychologist, talk to peers, for example, right? And listen to the music or go, like you said, go to the park or even spirituality. So what else you think you can suggest in us to have as a recommendations to kind of take care of ourselves?
I think as providers, we all should have a list of at least 15 things that individually helps us relax and helps us center ourselves. So for example, for me, if if I'm just feeling overwhelmed, then listening to spiritual music will do it. If I listen to a few gospel songs, lifts me up, I feel centered. If I'm in the emergency room and we have a tragedy where there's a loss of life, that takes me lower. So for that, I have a Thich Nhat Hanh CD that I listen to. Thich Nhat Hanh is a Buddhist monk. For some reason, he centers me. So I know that when I'm in my lowest, Thich Nhat Hanh is my man. So I just automatically pull it and I listen to it, and that centers me in the here and now. I become more grateful, not be in this sad space
Mhm.
of what I just witnessed.
Mhm.
And if it's something mild, just a sad news that a patient shared that just connect with my own story, I
That
don't
too.
come straight home. I go to the gym and I work it out. I shower at the gym so I can leave whatever that thing that stick to me at the gym so I don't
That's the
bring
gym.
it home to my family.
That's a good one.
I give massages.
Yeah.
Massages are a great way for relaxation. So I have my list, and my
Mm,
suggestion is that
yes.
list is individualistic. So
Individuals. Yeah.
everybody have to create what do they do when they're moderately stressed, severely
Sure.
stressed,
Mhm.
triggered, and that way we take care of ourselves.
There you go. So basically, it's no specific like remedy for us to kind of overcome that, right? So whatever works for individually, just go forward with your, you know yourself, you know your limits. Basically, just go whatever is feeds best for your own need. All right.
Exactly. Some people run, some
Mm-hmm.
people
Mhm.
sleep. I mean, it really depends what
Exactly.
how we
Hmm.
self-care, how our body respond to things.
Hmm. Okay. So about another point is like recommending people for therapy, all right? So most we have this tendency, for example, for Canadians, you and I we talk many times like people not just from Fogo but from prior all over the place, they don't see therapy as a priority, all right? Therapy, psychologists for people for dodo, all right? For crazy, so it's not for us. I don't need it. So what's your recommendation for someone like professional high level, right? I do work with the people high level in their career, like top people in the country, for example, right? And then it feel like I don't need help, I'm okay. So what's your suggestion for those like definitely needed to before they become like the burnout level, crazy level, what they should do in this case?
We know that people of color tend to not we were not educated or trained to need therapy. Therapy is a sign of weakness. Although over the years, things have shifted. Therapy has become now something that is in the culture. It's kind of cool to have a therapist. It's not as, it doesn't have the negative stigma it had 10 years ago.
Mm.
Um, I think we all need somebody to talk to. We don't live in a vacuum. So it's not that we don't need therapy. We all need therapy. The question is that being in therapy does not make you insane. It's actually people in therapy are actually healthier than people who are not in therapy because they actually doing a lot of self-awareness work. Um, and I think in our community, a lot of psychoeducation that the benefits of therapy. I mean, you go and talk to an elder, you go and talk to padre. Why can't you talk to somebody who has the
Specific.
training and the experience to actually help you become a better human being?
Yeah, I agree with that, definitely. So we rather go to the priest and all those even friends, whatever, but psychologist is still a taboo, right? So again, I'm glad you pointed out that because we need to vocalize more about it. We need to talk about it and convince, not at least is try to explain to people, like put out there, like psychologists start helping you to not be crazy, right? You have someone you're gonna talk to, right? Preventing you to be crazy if you vent your thoughts, your feelings before you act on those. Definitely, I'm glad you pointed out. So I still have other people in this panel, Dr. Selena and then Jennifer. I don't know if you guys have any question for Dr. Rosilda, if you guys want anything inputs to add what she shared with us so far.
I could probably add once I talk on vicarious conditioning that things
Mm-hmm,
that she's kind of tapped into.
mm-hmm. Okay. All right. You guys have any question for Dr. Rosilda?
Probably at the end.
In the end.
Okay.
Mhm.
Thank you so much.
Okay.
Very informative.
Yes, thank you very much.
Yeah.
Okay. Dr. Rosilda, anything else you wanted to add before like move on to our next guest?
Go ahead to the next guest. Thank you, though.
All right. So thank you for your sharing, for your knowledge. Definitely 30 years doing service the way you've been doing it, still full of energy. I'm jealous in good way. I wanted to continue to do the same way. And that's why you guys inspire me so much. So thank you again. I'm sorry. So I'm gonna move on to Dr. Selena right now because we're gonna end with the Jennifer, maybe some interventions, some practical thing we're gonna do. Maybe she's gonna teach us some skills to deal with not just trauma. Dr. Selena is gonna talk. Dr. Selena is gonna talk in a little bit, but also the topic Dr. Rosilla just shared us. How can we manage? How can we have a self care like intact in place for us to not be overwhelmed to work? So, Dr. Selena, good afternoon to you again.
Carlos, always nice to be with you.
Pleasure, it's my pleasure. Dr. Selena, so I read your book. Uh, and definitely was very, very informative. I love it. It's so easy, simple to read and to use it. So I know your resume is so huge and your biography is so long. We don't have maybe time to go all the things you did your entire life. Can you please summarize us? Like, if someone asking me, Dr. Cimedo, Carlos Cimedo, who is Dr. Selena? How can I respond to those questions?
Well, I would say
Besides,
that
besides, besides be my madrina, though.
I know I keep on remembering that. You give me a big job. It's a big job. Well, Dr. Selena is simple. She's a simple woman who has a lot of deep feelings for what she believes in, and she is a committed person to her to her people and to her people that are close to her and even people who are not close to her. Um, I've been practicing 30 years. I'm an author going on my fourth book now. And Dr. Ozilda needs to mention her three books she has coming out. She didn't mention that. Um, so yes, I do have my 5 keys to emotional oneness, emotional detox system. I launched one in September out of Switzerland on energy bandwidth and epic times, and one on cutters that I did a while back. And I have one I'm working on now on autism, trying to put together a book for Cape Verde for the communities to have something to go on when they're working with those children who have autism. So I mean, I guess I'm a mental health practitioner, and I am a trauma specialist, and I've been doing this work probably 25 years in trauma. My training was probably before that. And I've been in private practice for 30 years. And today I just wanted to kind of touch on vicarious trauma, because I think not trauma, but conditioning or responses. So I think it's something that we take for granted, that we don't really look at when when it comes, as Dr. Zilda mentioned, in terms of burnout as well. So is it okay if I get started, Carlos?
Of course, the floor is all yours. So just keep it going.
All right, well then I will do just that. So vicarious conditioning and our responses is where providers experience psychological or physiological symptoms that mirror or parallel their patient's trauma, stress, distress, without having directly experienced the traumatic events themselves. So, and I was talking about how that happens, and I think we all know that. But even, those times when we don't think about it, we don't realize that it might be happening. So there's a mirror neuron research that shows that observing others' experience activates the same brain region as a direct experience. So that's pretty powerful. So if you're having an indirect experience through observation, it could almost kind of impact you in a direct experience. So when
Yeah.
you witness patient distress repeatedly, what happens with the brain is your amygdala, your hippocampus, your prefrontal cortex responds as if it was experiencing trauma itself.
First hands, yes, yeah.
So, and then it heightens the trigger when you have a high risk scenario, which might include pediatricians, who see pediatric trauma, or when there's a sudden unexpected death, which we see on social media in the news all day long, not even with just our patients, but with families who are suffering, and all the things that are going on in the world right now, and all of the mass killings and all that stuff that's really been, a sudden, unexpected
Affecting it.
in many cases. Cases involving violence and abuse. We know that's all over the globe, and it's becoming very, very much more vocal, and we're hearing about it more. And there's more visuals because media has not, it was a time when you wouldn't see the incident, but now they're just, well, look at this because it's, or don't look at it because it's going to be very disturbing, the news might say. So
Yeah.
others involving and then patients whose circumstances mirror your own personal experiences. So, none of us, I don't know that any of us are privy to not having some type of distress in our life.
Yeah.
And if you're one of those people, we really need to get to know who you are and how you did it. So if it mirrors your own personal experience, those triggers are at high, high risk. And we have to really identify those. And repetitive exposures to similar traumatic presentations. So here are some essential elements that maybe we should think about, because we don't think about these either, because we're always on the move. But so let's think about it neurobiologically. So it's a neurobiology, it's a mirror neuron system, right? So what happens, it operates at a cellular level. So the physiological mechanism is in observing and activates your neural pathways. So that's a whole lot of brain talk. And so that was just for whoever might understand that. Because what happens, it does activate as a direct experience. We have to know that, like, why did this make me feel some kind of way? So I have past trauma. And there are times when something may trigger me and I might be like, where did that come from? Why? And I may have a shift. So we have to watch those shifts. And they affect everything from pain perception to emotional regulation. So to think that many instances that occurs through just hearing their stories. We listen to the stories all day long. And God bless you, Dr. Rosilda, because I used to do the same thing in the emergency room. And then when the trauma room lit up and they wanted me to go down and talk to a family because there was this traumatic sudden death of maybe one of their loved ones, that was the most difficult thing for me because the visuals were there. You see the visuals every day. When you're in the ED, those visuals come to you every day. When I'm hearing the stories, I maybe be filtering out what I can protect myself from, but in the hospital setting, in those settings, the EMSs, the police in the streets, the firemen, they get those visuals every day. So, but it comes through hearing their stories, treating their conditions. I mean, looking at the scars. I mean, not only are there internal scars, but many times our patients come in with external scars.
Yeah.
I have one, I think it's my vision, addressing traumatic injuries and becoming witness to pain, fear, terror, trauma, and that they've experienced. So there's
Yes.
a lot coming at us, and
So,
you know that, Carlos, because
mhm,
you
mhm.
do that in Cape Verde when you're doing
Yeah.
suicide stuff.
Yeah.
Seeing the visual, you're
Yeah.
seeing the real deal. You're
Yeah.
seeing pain, you're seeing the terror, you're seeing the trauma, you're seeing the distress. And sometimes
Yeah.
it's, what do I do with all of this? Even though
Yeah.
we want to do it, we want to be there, but we get infected by it sometimes and affected by it.
Yeah.
So this presents symptoms in these kind of categories. You want me to stop for a minute, or can I keep going?
No, so yes, definitely you did a good job on that. So the question I have in this case, like trauma, right? So you define very well. You're talking about the visual trauma, the trauma direct,
Well, it's
indirect
not only
trauma.
trauma. It just could be stress.
Stress, exactly. So, but if focusing trauma though, for example, I have a client, for example, he come to my office and talk about many stuff, but and then she never talk about being traumatized in any kind. So after many sections, many workout, and now we found out she suffered like a traumatic trauma growing up. She was too young to remember, right? So
Mhm.
what we gonna do for those traumas being buried for so long? Or people do not recall or purposely try to bury it because it was too traumatic. So how we address those?
So because we're talking about vicarious trauma, because that's a whole nother subject when
Hmm.
you have to uncover those. I call that
Hmm.
unlocking, unveiling, and unleashing. That's how I do my work to get to the
Hmm.
root of things. But the thing is how do you feel about uncovering those things? How does it impact you? Because
Exactly.
vicarious trauma does. As many times, then we have to be careful because when that does open up and comes out at you, sometimes I've had people who had multiple personalities and all things started to shift fast, and somebody else is talking to me. So sometimes the person gets so scared that they leave your office running because they're in fight, flight, and fear. The amygdala has just lit up. We have to be careful, but when that
Mhm.
happens in our presence, that causes some impact on us as well,
Exactly.
right? Because like, what just happened here? Did I move too fast? Was I pushing too hard? So
Mhm.
we have to be careful
Be
on that,
careful. Yeah, okay.
right?
Okay.
But
Okay.
Yeah. So
Yeah.
some of the vicarious symptoms that we might see, however, in
Mhm.
our situations, maybe like physical symptoms like chronic headaches, GI
Okay.
disturbance, sleep disturbance, and maybe
Mhm.
cognitively inclined, difficulty concentrating, memory issues, cynicisms, um, issues or criticisms, emotional numbness, irritability, loss of empathy. That's another big.
That's that big one, definitely. Yeah.
Um,
Okay.
and behavioral markers, increase in absence. So your behaviors, you got to watch those. Increase absenteeism, substance use, interpersonal conflicts. So there's so much that we have to be aware of
Be
that's
aware.
our
There
own
you go.
internal
Yeah.
systems.
So, Dr. Tinafu, everything you just share, like the definitions and then the causes, and then the us people to be aware of those symptoms. So, how the best way to kind of cope with this, the interventions you might share with us in this process to deal with the vicarious trauma. So, what's the recommendation you might have for us today?
Okay, so let me just talk about one more thing first, all right? Because it's a very important piece of who we are. And it's a piece that Dr. Rosilda brought up. Um, so we know that it occurs through repeated exposures to patients' traumatic narratives, suffering, and distress. And we absorb and internalize these emotions and psychological pains through empathetic engagement, right? Because we are empathetic and compassionate people. That's why we do
Exactly.
this work. So through empathetic engagement, creating trauma responses, it upsets our nervous system. There's also a cultural piece to this because not only that, so I don't know, I mean, if it's man involved, the men involved, or the woman involved, or both involved, but when we are faced with these kinds of things we just discussed between, what Dr. Zilda and I just discussed, um, there's a fear that they may show up as weak. So they don't want to show these symptoms. So do you see the compounding that's going on here? So the very qualities that make healthcare professionals effective, those very things that make us effective, that makes us work, make this our compassion and our empathy and attunement becomes our pathway for trauma transmission. So that's to me is like
It's
so
amazing.
important. So important. But the
Yeah.
cultural piece to this is that it brings up instead of it becomes a stigma. It becomes a stigma and a weak, they don't want to be seen as a weakness. So rather than it's seen as a weakness rather than an occupational hazard. It's not a weakness, it's a hazard.
It's a hazard.
It's a
I agree.
hazard.
Yeah.
So to try to get to what you wanted to set me to talk about. So let's just talk about prevention for a minute, okay?
Mhm.
Because we have to do prevention. We have to be alert and alarmed, not alarmed, but alert to this, what's going on in our bodies when we're feeling all these things, making these shifts. So we should always keep, like Dr. Zilla said about what she said about making a list. That's an important thing to do so that you can have something to choose in terms of what you're going to put together for your care plan. But there are so many different care plans for us to get through this stuff that, because there's systemic and there's family and there's peer groups, there's all kinds of things you can do. But I'm not sure that those things are even open and available to I mean they are open and available, and it's just a matter of us going to get through those. But
Okay.
some of the early warning signs may be physical, like chronic
So,
headache.
chronic headache. Mhm.
We kind of went through that, and the cognitive pieces and the emotional pieces, the behavior marker pieces. So look for those because those are important. But
Yeah.
then in terms of what can we do, I have to go on what Dr. Rosilda said. It depends upon the individual and it depends upon the impact because it could go from I'm going to cut up every morning and I'm going to do my diaphragmatic breathing and I'm going to activate my vagus nerve and I'm going to reduce my parasympathetic system so I can rest and digest rather than be in fight, flight, and freeze in my sympathetic nervous system. And I'm going to really learn how to do that. And I'm going to do meditation. And these are things that Jennifer is going to be good at telling us. I'm going to ground myself. I'm going to ground myself and I'm going to make sure I'm present so I can keep myself going. I'm going to look at this as this is a hazard and it's not a condition. Or it could go to the whole other side of things where this is impacting me. It's bringing back memories of something that happened to me in my past. And I don't even know what that is, but I keep on feeling I'm having nightmares. I'm having shaking. I'm having visions, images of things that I can't put together in my head. So it can go from, from being able to manage it all the way to being able to really need to get some clinical or complementary or alternate holistic type of work done. As
Yeah.
Zilda mentioned. So there's a whole bunch of things you can do. There's lots of signs and symptoms for this stuff. And I think that the last thing I'll say, and I'm trying to not use whole 20 minutes here, is that we have to also be aware that with all the work that we do, there's still a life that we live. And within that life, there's times we have to care for elderly family members. This daily caring and our safety of our children. And, are they going to get home? And, they're going to catch the bus to school and are they going to be safe? And there's community trauma. When I first opened my practice in 30 years ago, my daughter was going to a private school off the island, and we were walking back to my practice, and there was police down the street, and we kind of, you look and see, but there was a dead body in the street. She had never seen that, nor had I. So, there's a community there's environmental things that happen.
Yeah.
And then there's the increase in significant mental health complexities. Increase. I mean, mental health has gotten harder. It's harder to do.
Yes.
And that's probably something that we need to all talk about and join hands on
Yes. Definitely.
and have a
Definitely.
conversation. Like you just asked me a
Yeah.
very important question. How do I get through this with this person who just got through seeing that she's had these horrible things happen in her life?
Yes. Yeah.
So,
Yeah, so I do agree 100% everything you shared. I believe now I just got a little bit more knowledgeable today after listening to you, Dr. Rosilda, Dr. Selena talking about your perspectives. But talking about this today's society, we live in an environment definitely the mental health and become more and more important, more necessary because the society seems to be upside down right now. So I'm glad we discussed this today openly, honestly, with someone who have a very top knowledge on these things. So, and thank you so much for sharing this, Dr. Selena. It's always my pleasure having you around. Definitely, it's a good information being shared with us today in this CVAMS podcast today. Again, this is not how many sections we have so far in this? This is the number one.
we only have I forget which one this is. I think there's somewhere around 9.
9. So
9.
definitely, so we've been providing this to our community. I hope next time we're just gonna do in Creole maybe for people in Cape Verde to be more like participating and have questions. Maybe we're gonna make this more like I don't know, open setup. People can participate. But for now, I would like to move on with this Jennifer. Jennifer, how you say your last name again?
Groby, like grow
Groby?
and a bumblebee. Groby.
Okay. So thank you for letting me on that. So Jennifer, you're not the last. You just the one to close it up because we need your perspectives to how we're gonna put those two knowledge we just got. Like mostly talk about trauma and then the burnout on our daily life. So how those two great information we got for those two doctors, how can we put it together in intervention piece of it? So I would like you to start also to tell us who is Jennifer.
All right. Well, I am a licensed clinical social worker living in Northern California. I have been here for 30 years, or more, probably 40 or more. But I was born and raised in New Bedford, Mass. Have dual heritage, so Cape Verdean heritage is couple of generations from San Nicolau, and then Caribbean heritage is from the West Indies. So I had a rich cultural experience growing up in New Bedford. And then I went to college. Right after college, came to California, where I am now. I did attend graduate school here in social work. But I would say I started out as an educator and always had a calming effect on children. The teacher who pulled kids out because either they were disruptive in the classroom or just couldn't keep up. And I always had a soothing environment, I think, like with a record player, and we did guided imagery way back then. I went on though to get a degree in social work, and I anticipated becoming a school social worker, but I ended up being in the gerontology program / agency management. So it was a little bit of a stretch to do direct service, but I did get my license and have since enjoyed my clinical work. I worked at Kaiser Permanente for 32 years in various departments and inpatient, outpatient, and even at regional offices. So I'm very fortunate for that. So I always along the way in all my career journey did some kind of calming work, guided imagery, relaxation, and even in a church service or something like that. So I think we'll say that I have psychospiritual leanings. And so that kind of led me to become attracted and involved in energy psychology. It's really psychospiritual. I was in a workshop and the teacher talked to me about going to the conference and on a scholarship, and I tried it 10 years ago. Dr. Selena attended last year, so she can tell you that it's a lot of psychologists and MDs and psychiatrists and other people who do acupuncture, acupressure, but all working together on some type of healing. And energy psychology pretty much is just psychology, talk therapy, and then focusing on the meridian. So trying to get two systems, the talking system, but then the touching. Some people do tapping and it's tapping on the meridians. There's different things to do. And it was very attractive to me and I like it very much. I will say about vicarious trauma, I did research one time and if I'm correct, or correct me if I'm wrong, the term originated during the Holocaust when the Germans were very organized, the Nazis, and they would interview and take stories from the people going, who were on their way to the ovens. And they became so burdened with the experience of listening to the stories that it was identified as a thing, and that's vicarious.
Yeah. Sure. Okay. Thank
but
you
also,
so much.
oh, yeah, okay.
Continue.
But you both, Dr. Selena, Dr. Rosilda, have worked in hospital. I also became aware of medical trauma, people who just have so many surgeries or one condition after the other, and it's traumatic. So there, it's a thing too, medical trauma.
Okay.
Good.
Thank you so much. So today you're going to talk to us about energy psychology, all right? So for how long you do this energy? Because this is new for me. I know I read something about it, but it's something I never use it in my practice, like energy psychology, all right? So tapping and all those other interventions. I'm kind of most like CBT guy. CBT is something I'm expertise on. I have license and everything. So hey, can you tell us more about energy psychology? So how that is a new thing, and I don't know how old you can teach us how long it's been going on, for example. So how energy psychology has been helping you in your profession?
So I have been able to listen to someone tell me their problem. We always get a rating of the problem, the SUDS, subjective, scale. Is this bothering you a little bit or a lot? And then we would just sort of go into talking about the problem with certain guiding words. Even though I'm concerned about my mother's illness, I love and accept myself. And then we're saying those things and we're tapping on different parts. There are different versions. There's thought field therapy that thinks that, there's a whole field of thought around us and how to manage that and move that forward. the guided imagery that I like to say is my favorite or my skill because kids have liked it. People in church groups have liked it. Right now, I use it a lot at an integrative medical facility for women, low-income women with cancer. So I get to listen to their concern, get them into breathing almost in a not a trance-like state, but guided imagery is part of some programs,
No problem.
NLP programs and things like that. So, and you just get quiet, you let all the world continue around you and let it, and just focus in on your very center. It could be your spirit center, your mind's eye, whatever, and just take and then relax and take in new information. It could be um, image imagery scripting, sometimes it's called.
So,
Now, and it's not for everybody. It's not for people who have hallucinations or anything like that. So you do have to screen
the screening, yeah.
no, you don't want to cause any more damage.
Okay.
I wrote down something when I earlier that I heard about was it Dr. Rosilda said you get so stressed sometimes that your plate, in life, your plate is full. And I can remember like 6 or 8 years ago, I said, my plate is so full. I have noodles hanging over, sauce dropping off the edge, and now I have portion control. So it can happen, it can be
Yeah, it
done.
does. It does. Yeah, it does.
I want to say that what energy psychology tools and practices, whether it's tapping or something to do with the meridians, it's a self-regulation tool.
Self-regulation tool.
And so
Okay.
when people, for staff, for colleagues, and for clients, but for clients who don't really, or cultures or communities that don't really understand or want to accept therapy, you can introduce a self-help tool. And of course, the organization I'm involved with has all kinds of videos and things like that are resources free. And that's a way to help people understand. And when they feel better, they go, oh, okay, I guess something.
Yeah. Yeah, definitely. Thank you so much for that, though, because this is self-help tools you just present to us. Because we, as a therapist, we're gonna be to clients' office when they call us, but end of the day, we're supposed to provide them with the means for them to take care of themselves. Because we cannot be with them 24/7, right? So end of the day, for example, me work with people like with suicide tendency. I need to provide them the guidance for them to try to stay alive, all right, to do something to take that thought away of harm themselves, all right. So I'm glad you put it that way, so simply, that is a tool, the self-help tool, like typing. I'm thinking about some things, folks, because by doing so, our brain is going to be distracted for that negativity, all right. So I'm glad you put it the way you put it. And then mostly I'm kind of happy because all three of you guys wrote a book, all right. You guys have a book out
I
there.
have
People
something
can read. People can learn more from it. So the question I have for all three of you guys: if someone's wanted to contact you guys for like, not just for book, but to get your knowledge, to get your support, your help, how people can contact and you guys in the sense, Dr. Rosilda, for your vast knowledge in everything, marriage, culturally, therapy, all those stuff. Because I read your resume and said, I need to reboard it 3 times and still cannot do it. So how people can contact you guys, Dr. Rosilda, Dr. Selena, and Jennifer, you guys have a book out there. How can people contact you for I don't know, for anything, for books, like I said, for counseling, for example, right? For suggestions, someone to talk to you for them.
Well, my website is drselinaoneness.com.
Okay.
You can get my information from
Your
there.
information there. Okay, website, Dr. Selina's website. Dr. Rosilda?
I'll go with Selena. My website is RosildaAlves.com. So that's the best, quickest way to get to me.
To get you. After they want to find out all the information, like emails, phone number, and then all
Emails,
those
phone
kind of
number,
information.
everything's there. Yes.
Okay. Jennifer?
And the same for me is newly developed, jennifergroby.com. And I have my inspiration cards that I just created with an artist friend. So
Sure.
they will be
Mhm.
available there and be able to support you.
There you go. Thank you. So, covering in this conversation today, at the beginning, I asking you guys have any question to each other that I can maybe I miss it to ask? You guys have any thoughts for what we shared today? Any question to each other? Any suggestions, recommendations?
Yes, I think we need to do a retreat. I think we need to do a retreat in some beautiful country with you know
Mhm.
outside of the United States.
Retreat. I love that. I love that one.
We need to bring our knowledge together. We need to join hands. We need to be supportive of one another
Yeah, you go. Yeah, be together. Be
without it
supporting one
being
another.
a
That's yeah.
project or a plan. Or
Humble. We're supposed to be more humble. Society's going crazy right now.
I want to
Yeah.
remember that all of us come from a very rhythmic culture.
Yeah.
A
Yeah.
rhythmic
Mm.
culture. So if you don't want to do
Mhm.
anything else, dance. Put on some music and dance because
Yeah,
all of
I
that is
agree.
bilateral stimulation. All of that, the other thing is, use your stories. I create safe places with all my clients, even when I do EMDR. I mean, I do it with EMDR, of course, but even
Mhm.
without EMDR, I do that. And people
Mhm.
really sometimes don't even know that they had a safe place in their childhood that they can still use to go back to get themselves reconnected. So, but our culture is all about music and dance. We have a beautiful, beautiful culture. And if I want to I just want to just say to you, Carlos, thank you for doing this. And also that you mentioned of speaking, having this in Creole. Well, I wish that this will reach out to sponsors who will say, we will take your videos and we will put it in summary in Creole now. So that these videos that are being shown right now, we will put them in Creole on your YouTube channel, on your Spotify, so that they can hear them in Creole as well.
Yeah.
Does
Yeah.
that make work for
Thank you.
you?
So I hope the sponsor's gonna listen to us and maybe do something about it. So for now, definitely I wanted to thank you guys for your time, for your knowledge you guys share with us today. Our community much richer after this conversation. These three monsters in psychology you guys brought so huge and informative uh, documents by sharing what you guys sharing today. So I believe we definitely, for my part, I'm gonna feel happy, not just by a content and everything else. I don't know how to express it to be with you guys. So thank you again for your participation. I hope you guys are going to continue to do a great job. Do not allow these 30 years in the fields take you guys any energy away. I'm 20 years in the field. I'm looking forward to be like you, Jennifer, Dr. Ozil, and Dr. Selena, 30 plus years doing this thing every single day. Especially Dr. Ozil right now, you might be on call in the hospital for crisis. I did the crisis. I'm still doing it. It's not joke, right? It's no joke. And then we're talking about second-hand trauma that we need to pay attention to in order for us to kind of continue to do this job. And then self-care, 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 self-care.
Absolutely. Absolutely.
Thank you for hosting.
Thank you.
Thank
Thank
you for
you.
your time. Thank you for all this great knowledge, expertise, and doctors in the house today. Thank you so much.
All
And
right.
then see
Okay.
you guys
Thank you.
soon.
See you
Yes.
soon.
Bye bye.
Ciao.